Because of the widespread shutdown and the need for distancing, the Boston City Council's changing operations. That means different ways of helping people in the city with everything from services to emergency regulations. To tell us about his own role is the City Councilor representing South Boston, the South End, and Chinatown, Ed Flynn. Thank you very much for joining us, Councilor.
It's good to be with you, Chris.
Councilor, start by talking about what you're seeing when you go outside walking through your district. What's it like out there?
It's pretty quiet out there. We do see a lot of people that are taking the recommendations very seriously. They're going to supermarkets, or they're going to takeout restaurants for food. But for the most part, people are staying inside. But we need to continue doing a community. We need to continue doing outreach to everybody to make sure that it's critical for them to stay inside and respect the boundaries of social distancing as well.
Do you see some signs that people are not getting the message yet?
There are people that are not getting the message, and it's up to us to continue to remind people about how critical it is for everybody to do their part. This is a disease. This is a public health crisis that impacts everybody regardless of age. So it's also critical that our young people, our young professionals that are in our city, they do our part. I don't want them spreading the coronavirus potentially to seniors that could have more medical conditions that could really impact their public health.
Now, I know it's not a hot day in August with people strolling around Castle Island, but people still like to go out there this time of the year, walk around. Ordinarily, they would sit on a bench and relax, and I guess they can't do that now, at least not sit down on the bench.
No, they can't do that. They can have a brisk walk, usually a couple or a parent and a child, but it's not recommended for a group of 5 or 7 young people to go walking and talking on a leisure walk. This is about getting some exercise, so your health is good, but it's critical that we have social distancing, and social distancing includes 6 feet away from another person, and no fewer than 4 or 5 people together. So it's critical that everyone does their part. This is an international crisis, and it takes everybody to be involved, to do their part, so our city and our country is safe and healthy.
Now, whether you're walking down Broadway or if you're going through Chinatown, you see a lot of businesses that are shut down. A lot of people are out of work, and not all of them are eligible for unemployment. What about helping people like that?
Yeah, you're right, Chris. A lot of them are not eligible for unemployment. We have a lot of low-wage workers, a lot of immigrants that are working, that we're trying to figure out how they can be eligible, how they can file the necessary documentation. They play a critical role in Boston's economy. More importantly than that, they have families that they need to pay their bills as well. So we want to make sure with this stimulus bill, it impacts the low-wage workers, it impacts our working families, and that's where we start. We start from the bottom up, and it's about helping the workers, not necessarily these major international companies.
You've also tried to do something with a resolution on the City Council. Can you tell us about that?
Yeah, I've called for several resolutions on the City Council. One is in support of our veterans community, making sure that they have the necessary services, programs that they're entitled to, especially during this shutdown by the coronavirus. I'm also calling for a resolution where if you are working, that the insurance companies should not be able to cut you off from their premiums. They need to keep you on the books. You might not be able to pay the monthly fee, but it's critical that they not cut anybody off of the insurance, access to insurance. And the other one, Chris, is supporting our nurses. We need to make sure our nurses throughout the state have the necessary services and necessary supplies so that they can do their job. They need gloves, they need gowns, they need masks. They're putting themselves at risk of catching this. Many of them have. And for them to self-quarantine, we need a designated space as well. That might be at a college or a dorm or a hotel room. But they don't want to go back to their families so that they can spread that coronavirus to their families. So our nurses and doctors are on the front lines. They're the real heroes. They're the people that are doing the tremendous work. So we have the greatest respect and admiration for them. Mass Nurses Association is doing an exceptional job representing our nurses as well.
Yesterday, at the council meeting, there were other resolutions in play to help people affected by the shutdown, the measures filed by Julia Mejia, Ricardo Arroyo. These are things that people need help with. The resolutions are sort of ambitious because the council doesn't directly control these things. Why is it important for the council to pass measures or at least consider them right now?
Well, it's important for the council to be engaged, to be active. We have great relationships with our colleagues on the Hill, whether the state reps or state senators. We talk to them all the time. We work together. So it's symbolic that the city of Boston, the city council is supporting, making sure that residents are treated fairly and have the necessary funding so that they can pay their bills. So it might not be binding, but it has a lot of weight up at the State House, because state legislators, especially from Boston and Greater Boston, want to know what the city of Boston, what the mayor is thinking on a particular issue.
Well, you've been focused on the virus phenomenon for longer than maybe other people in the council. You represent Chinatown. There was this early identification of this virus with China, and of course that had an impact on people in the community. You went out, you talked to people in Chinatown. What did you learn from them about that impact?
Chris, I've been dealing with this since early January. What I learned is the residents want accurate medical information. They want us to communicate that to them. They want us to be honest, upfront, and direct. The residents also want us to communicate in their language. I'm fortunate enough to have 3 members on my staff that speak Cantonese and Mandarin, and I have another woman on my staff that speaks Spanish. So it's critical that we reach our immigrant neighbors, making sure that they receive the necessary and accurate medical information. I'm constantly working with Chief Marty Martinez from Health and Human Services on language access, but making sure the most vulnerable in our city know exactly what's happening and what precautions they need to make as well.
It wasn't so long when President Trump referred to this virus as the Chinese virus. A lot of us pass that off and saying that's Trump just trying to be outrageous. But if you're a Chinese American in your district, what's that mean for them?
It was scary. It's clearly racist. It's clearly discrimination, but it makes a target of the Asian community as if they're responsible for bringing this virus to the United States. What we need in this city and what we need in this country is for people to come together, especially during difficult times, treat everybody with respect, dignity, fairness, love, empathy, especially our Asian brothers and sisters. We're all in this together, and each person has a part to play. Each person is important, and each person deserves to be treated with dignity. And it's important that our immigrant neighbors know that we support them, we love them, and we're here for them.
It wasn't so long ago when calling off a St. Patrick's Day parade for any reason except for weather maybe was unthinkable. Looking back now and thinking of what happened in New Orleans with all the COVID-19 cases around there right after Mardi Gras, what do you think it would have been like here if that parade had taken place? If there had been all these people coming into Boston for the parade and going out to all these bars and getting in crowded situations. What do you think it would have been like here?
Well, we met with Mayor Walsh prior to the cancellation of the parade, and we decided as a group, South Boston elected officials and Mayor Walsh, that it should be canceled. It was the right decision to make. I want to say thank you to Mayor Walsh and my colleagues in the South Boston delegation. But it would have been a huge mistake to have the parade. It would have put literally millions and millions of people in jeopardy of potentially passing the coronavirus on to other people. But also, it was the right decision to close the bars and restaurants. We started that here in South Boston, and it went across the city. But we want to make sure that, that our restaurants and small business are also, that are impacted by this, that there's also an opportunity for them to come out of this recession. But what we're asking now is we're allowing takeout of restaurants and fast food place, no sit-ins. But it's critical that we get these restaurants, giving them an opportunity to make a living even during this crisis, but making sure that public safety is also the number one priority.
Finally, Councilor, I know you're helping with a lot of updates on your Twitter feed, so if people want to find that, how should they look for you?
Yeah, they can look for me. I'm on Twitter and I'm on Facebook. They can also access me at my email at City Hall. I communicate all of my Twitter in Spanish and in Chinese, and in Facebook as well. So please reach me at Ed Flynn on Twitter, and same with Facebook, Ed Flynn City Council. And we update it several times a day. We provide relevant information on how it impacts residents across the city, especially our seniors, persons with disability, our veterans, our immigrant neighbors. And what is a critical part of this public health crisis is language access, making sure all residents, regardless if you can speak English or not, but making sure all residents know exactly what is happening and what precautions they need to take.